Good morning, everyone, and welcome to day 2 of Iowa Ideas. This is our 9th year of Iowa Ideas, an event that explores topics that are important to Iowans. The Gazette would like to give a special thank you to our presenting sponsor, ITC Midwest. Our sponsor support helps make the Iowa Ideas discussions free for all. Audience, you'll be able to submit questions to our panel today by entering them in the Q&A box or in the Zoom chat, and we will work to incorporate those into our conversation. And for this session this morning, we will be discussing some of the things that are being done to help older Iowans age in place. The U.S. population is older today than it has ever been, and that demographic shift is only expected to continue thanks to ongoing medical advancements and overall quality of life improvements, both in the Midwest and nationwide. And as the general population and the workforce get older and live longer, we'll talk about how Iowa communities are adjusting to help older residents continue to embrace and engage with their communities. And I am Emily Hawk. I'm the Special Projects Editor at the Gazette. And today I'm joined by a great group of panelists. Will each of you just quickly introduce yourselves, your affiliate organization, and then talk about what you do there? So Susan, you are left center. So I will go ahead and have you go first.
Okay, my name is Susan Chilot. I am currently chair of the board of directors of TRAIL of Johnson County, which stands for Tools and Resources for Active Independent Aging. We are a membership-based nonprofit located in Iowa City, and we help older adults throughout Johnson County age in place by providing volunteer services, socialization, access to vendor recommendations, and other services that just help them live more safely and comfortably in the places they call home. I'm one of TRAIL's original founders. We've been at this for about a decade, but incorporated as a nonprofit in 2017.
Awesome. Thanks, Susan. Jessica, do you want to go next?
Sure. Hello, everyone. I'm Jessica Andino, she, her pronouns. I have the pleasure of serving as the executive director of the Johnson County Affordable Housing Coalition since 2023. We are in our 10-year anniversary mode this year of the coalition, and we work together to educate, advocate, and then also partner for low-income residents of Johnson County, because we believe that every resident of Johnson County should live in safe, decent, stable, and affordable housing in the neighborhood of their choice. Myself personally, I'm a lifelong resident of Johnson County, and I am an alum of Iowa and also a current student at Iowa. So I wear a lot of different hats. I'm currently a PhD candidate over at the College of Public Health in the Community and Behavioral Health Department, looking at housing and health and the connection between those two, specifically for residents in manufactured homes. Thanks for being here.
That's awesome. Thanks, Jessica. Michael, do you want to go next?
Hey, everyone. Thank you for inviting me and AARP Iowa to be a part of this conversation. My name is Michael Wagler. I'm the state director for AARP Iowa. AARP is a state office of the National AARP organization, and with a broad mission to empower and advocate for the 50-plus population here in Iowa and across the country. We have over 325,000 members here in the state of Iowa that we directly speak on behalf of, but really truly focusing on the 50-plus community on everything from financial security to caregiving to livable communities, which is a direct tie to this conversation. About a third of the work we do here in Iowa and across the country is centered around creating active, vibrant, safe, and accessible communities that allow all of us to choose how we age as we grow, but also more importantly, like Susan and Jessica both talked about, of live where we choose, and whether that mean aging in place in the home we're in or making an appropriate change to age in our community to stay active, both physically, socially, and mentally.
Awesome. Thanks, Michael. So we've got a great group of panelists here today. So I'm just going to go ahead and dive in. So my first question, so from healthcare to affordable housing, to finances and even to caregiving, what are some of the current barriers facing older Iowans today? And what are you seeing specifically in your work on this subject?
I'll jump in, and by saying that when we talk about older adults, in the same way that we talk about the boomer generation, and many older adults today are part of this generation, my own generation, it's not a monolithic culture. I think we see this especially in Johnson County, where we are rated by numerous organizations as one of the top retirement communities in the nation because we have great healthcare facilities and culture and accessibility, and organizations like Johnson County Livable Community. But that pertains mostly to a population that can afford to come here and live here. I mean, we're also one of the most expensive communities in the state. So I think sometimes we lose track of the fact that, as Jessica knows, there is a very large percentage of the population in Johnson County of older adults who aren't so fortunate financially. And so I think one of the challenges is reaching the people who need our services most. Sometimes that population isn't as visible as others in this community, and they don't often know where to go for help. I think they are faced much more with social isolation, which is one of the most daunting challenges that older adults face. And we at Trail certainly try hard to help out with that situation. So those are some of the things that come to mind for me, is just meeting people where they are. And providing services that help all older adults wherever they might fall on the socioeconomic spectrum.
Mm-hmm. Yeah, and I'll piggyback off of that. So as Susan was saying, it's extremely expensive to be here in Iowa City and the surrounding areas. And when you think about rents, or you think about lot fees at manufactured homes, those just keep going up and up and up and up, while those that are on fixed incomes don't have that luxury of increasing the income to offset. So Social Security doesn't go up, pensions don't go up. And it's not only for those that rent, right? Mortgages go up. If you have an escrow account, your taxes are going up. So we have a lot of folks that reach out to us at the coalition of asking, how can I stay in my home? Because they can't afford, especially the upkeep of homes. I think that is often missed as well. It's not just those rents, mortgages, lot rents. It's about maintaining your home as well. If anybody's tried to hire a contractor recently, there's far and few between, and they're a little bit expensive if they even answer the phone. So imagine those that are on those fixed incomes being able to access quality contractors. It's very difficult around here.
Mm-hmm.
And I would ditto everything Susan and Jessica had said, and just add on to one of the challenges that we're seeing in Iowa and across the country is the reality of an aging demographic. Iowa is one of the older demographically states. In Iowa, when we get to about 2034, there will be more people over 65 than under 65. So we're really starting to change the reality of how we need to look at our communities. Not only should it always have been the case of having a diverse age perspective into how our communities are planned, transportation systems are planned, affordable housing is considered, but it's becoming even more of a reality that we need to be focusing on. And that's where AARP steps in from a city partnership perspective, helping cities understand the importance of accessible sidewalks and trail development and interconnectivity of where the housing is going to where the services are, understanding that if we could help our older population starting in their 20s and 30s of building the ethic, but if we could stay physically active, that starts to change the ability for us to age in place, because maybe we have the ability to take those stairs one more year. We have the ability to manage in our location. But then the flip side of that is as we get older, we're also seeing the prevalence of chronic diseases increase as well. So there again, in the next 30 or so years, we're going to see 100% doubling of the prevalence of chronic disease, which only exacerbates the challenges of all of us as we age, remembering that age is something that we're all doing right now, no matter how old you are. So then how that starts to tie into not only the physical side of what our communities are, but also the social side of looking at topics like caregiving, the availability, the cost of what that means, that becomes just another one of those barriers as we start to talk about community sustainability.
I'll pop in one more time just because that's who I am. Sorry, folks. But about the caregiving aspect as well. We have a larger aging population, as we all know, on this topic, but we have a lot of younger folks that wish to come back into our community to care for their, aging family members, and finding housing that's appropriate in a nearby setting for them has even become a challenge. So it's not directly always affecting those that are aging, but those that wish to caregive for those aging populations as well.
Mm-hmm.
Really good point.
Thank you. So, Michael, you kind of talked about this, but I think that we should define for our audience what it means to have a livable community. So what are some of the amenities that we should be thinking about? I know, Michael, you mentioned, walking trails. And what does it mean to age in place? I know that that's different for everyone. Kind of like Jessica touched on, aging in place isn't the same for everybody. So can you maybe just talk about both of those things?
Yeah, so obviously a gigantic topic, and that's part of the issue, is that it is so big, and it really touches all of our, so many of what our communities are. AARP identifies livable communities and really understanding kind of some key areas of housing, walkability, public spaces, transportation, and social connection. Understanding that if we could start to build that, it becomes a foundation. It's not a silver bullet to solve a problem, but it becomes the foundation for us to work together. Also understanding that if we start to look at this as an ecosystem, it really takes multiple different types of partners that may have not worked together in the past to really define what that looks like. And I think we all can agree that in these times, we really have to think creatively. We have to think in new ways. We have to think about our partnerships differently from that perspective. But when you think about livable communities and really defining it, it's everything from the ability to enjoy a park in an intergenerational reality. It's the ability to go for a walk, to ride a bike, to get around in a safe and effective way, and have accessible housing that, like I said earlier, is interconnected to those resources. We have a lot of really great housing opportunities, and some of them are only accessible via car, which then exacerbates the challenges of the transportation system, and then how that interconnects to economic development and workforce development and on down the line. But AARP has really put a heavy focus on that, of looking at small scale actions that can make big impacts to influence and encourage communities to take a look at this differently moving down the line.
Yeah. And I love that you called it an ecosystem. Everything, affects everything else.
Mm-hmm.
I think that's really important for people to understand that everything is connected. So thank you for that. Jessica, Susan, do you want to add anything to that?
I'll just add again a shout out to Johnson County. I think you probably all know that it's been 2 years ago, Johnson County made its entire public transit bus system here free. So no charge, which has drastically increased the ridership. That's been huge for older adults. I would also say that Trail for a number of years has partnered with the city's transportation coordinator. And when she learns of older adults who are having challenges, can't, make public transportation like seats work for them, they'll come to Trail and we'll be able to help them with transportation. And in terms of aging in place, although most of our members do live in what we would call their own, traditional family homes, we have a number of members who live in senior living communities where transportation isn't provided. And so they're Trail members so that we can give them rides to doctor's appointments or Hampshire or wherever they may go. So I completely support what Mike said about an ecosystem. It takes all of us working together, exploring new ways of partnering, and becoming aware of all the other resources. There's a great little new nonprofit here called Cycling with Age, that allows older adults and folks with disabilities to take bicycle rides. Actually, they're electric powered trike rides on the trails here. Another great way to get people out in nature, socialize. So understanding what resources are available greatly aids the whole notion of trying to age successfully in place.
Yeah, and when I think about livable communities, I sit on the housing action team for Johnson County Livable Communities Policy Board. It's really about neighbors looking out for each other, right? And designing a community that supports overall health and well-being, whether that be through these, services that we wish to connect them with, or the transportation opportunities or social opportunities. We obviously think with our, housing hats on all the time, but that ecosystem is so important. And it's within your direct street and block, to your neighborhood, to your city, to all of Johnson County, to all of Iowa. And how does that all connect? Because those services can be spread out across the state. I also really like to point out that aging in place doesn't always mean in your own home. Susan kind of talked about that already, but aging in place can be, is there, maybe I'm an older adult and my kids have moved out of the house and I don't need a 4-bedroom home. Is there a 2-bedroom home that would be appropriate for me in a location that I desire by those services or by those social events that I wish to attend, or right next door? And so having these purpose-built communities that allow individuals throughout the lifetime, throughout that life course spectrum, to be able to choose where they wish to live is really unique. I say that from a previous policy standpoint, maybe it wasn't done as well, but I think we have a lot of really good thinkers, planners, staff in a lot of our municipalities that are getting it and that are understanding. We wish that all of our community areas can be for all types of residents. So aging in place, again, is not just home modifications and trying to stick in your own home until the end. It's making sure that we can have a good community base and choice.
And I love what Jessica just mentioned there, is that idea that what's good for an aging population is good for the entire population.
Absolutely.
A lot of people look at it at 8 to 80. So what's good for an 8-year-old is also good for an 80-year-old. And I think there continues to be a stigma around aging, around getting old, and what that means for our society, or what that means for us personally as we face our own more mortality in some ways. But that's something I think from a community development and economic development perspective, if we could start to incorporate that age-friendly idea, that it's not just about focusing on quote unquote old people, it is about focusing on creating a safe community for everyone, understanding that the mayor, the city council, who may be in their 30s or 40s or 50s, will be eventually in their 60s, 70s, and 80s. And how can we start to understand policy has a long runway, and if we can start to back that up, we will be creating stronger communities for all. So I appreciate, Jessica, that comment.
Yep.
Definitely.
And so I also want to talk about in your respective organizations, how are you all addressing the challenges that are facing older Iowans? So let's, dive into, what specific resources and programs you have that are available. And how do you see them helping and working in real time?
I can jump in again. I've already talked a little bit about Trail and the services that we provide to our members. We have 2 different membership levels at a lower yearly cost. They're called affiliates, and I kind of think of those as social members who are interested in the events and activities that we offer, kind of taking Trail for a test drive, if you will, understanding what the organization is like, meeting the people. For full members, though, we offer transportation. We offer volunteer services and arrange, but transportation is our number 1 requested service, followed by a program that we call Phone Buddies, which is just a volunteer connects with a member daily, weekly, a phone call just to make sure everything's okay. This time of year, our volunteers do a lot of yard work. Later on, they'll be putting up Halloween decorations and Christmas decorations, just about anything you can think of outside of services that really belong to a professional, like a plumber or a carpenter. And in that case, we have an online application for our members that they can go on and say, I need a carpenter, do you know anybody? And other members will pipe in, and so you can trust those recommendations. I would also say that we have tried hard throughout our history to address the lower income population in Iowa City. If aging individuals meet a certain low income threshold, we take them on as supported members. And so there is no cost to them. And we're able to do that through generous support from corporations and individuals. We have about 30 of those individuals among our members now. And they tend to need us more than many others. Jessica, we've got a number of those folks in manufactured housing, and they face a different set of challenges. So we're really trying to help out on the services side and on the socializing side to make sure people get out into their community, make new friends. I went to a great presentation the other day by a couple of UI faculty members who are doing research in aging studies. And the advice was, as you grow older, learn to adopt new habits, adopt new friends, adapt to change. So we try to make as many opportunities available to our members that they can continue to adopt and adapt as they age. And yeah, I think that's a pretty good broad brush of what Trail tries to do for our members and for the community at large. I would also say that we try every year to provide or to present at least one or two large public events that continue to engage the community in conversations about what it means to age. The one we've got going on in October is called Closing the Gap, Health Span versus Lifespan, which talks about the fact that for many of us, we're living longer than ever, but that doesn't mean that we're staying healthy all the way to the end. And so it's full of tips for, taking better care of yourself, et cetera. So it's a full job, but we're happy to do it.
That's great.
I could jump in from the AARP Iowa side. A big part of what AARP does from a direct perspective is those events and activities that occur in Des Moines and Cedar Rapids and Iowa City and across the state. And they range from fun and fulfillment and things like movie nights, just to bring people together, like Susan said, just to break them out of that isolation cycle. All the way to education. A lot of what we do is building awareness for everything from caregiving, tools and resources to our Fraud Watch network. Knowing that fraud is not only a growing challenge for all of us across the country, but when we look at vulnerable populations, older adults are one of the vulnerable populations that are oftentimes victims of fraud. So AARP really focuses on how we can build awareness for what fraud is through presentations and things. Another big way that AARP directly impacts the aging in place and age-friendly conversation is through our online tools and resources. And there again, at aarpiowa.org and aarp.org, you could find a myriad of different resources that are volunteer-focused guidebooks that help empower people to be part of the conversation. And there again, those topics range from everything from housing and transportation on a more technical side to caregiving and financial security models from that side of things. But directly related to this conversation, our Livable Communities team is, like I said, about one third of the work of AARP, and there's still a lot of people that are very surprised that is the case, that we're working directly with community development type partnerships. But there are three ways that we directly impact that. One is our age-friendly community designation. Johnson County, Cedar Rapids are two designated communities in the eastern Iowa side of our state. There are 7 total communities across the state that have committed to using the 8 domains of livability as part of their strategic planning process. And sometimes that is a separate plan, like in Cedar Rapids, they have the age-friendly action plan. That is a separate plan that creates ties to other existing plans. Or in communities like Charles City, it's been incorporated into their community strategic plan. So there's really multiple ways to address it. The second area that we focus on in the Livable Communities area directly is our AARP Community Challenge Grant. So each year nationally, the Community Challenge Grant awards about a little over $4 million to small scale, quick action projects that increase the livability. And Jessica was celebrating there because her organization has been a recipient of the Challenge Grant. This year we had 7 challenge grants that were awarded to communities across the state of Iowa, including Susan's mention of the Bike with No Barriers, or Bike with No Age organization that has the Trishaws. Right. So that is just a really direct way that AARP Challenge Grant funds local projects. And then the last tool that I'd love to talk about a little bit is the Livability Index. So it is another one of those tools in your toolbox as a community leader that you could put in your address, your community, and it gives your community a score based on the 8 domains of livability and how that brings in. What I love about the tool is it'll give you a score of 62 for your address or your community, but then you could click on the subcategories and you could learn about how to increase your score in housing, how to increase the score in inclusion types of things. But then it goes one step further and recommends policies. So there's actions that you could take, but there's also policies from the public partnership perspective to increase livability. And there again, it's not the end all be all, but it is another tool in our toolbox to create more livable communities. And then lastly, AARP empowers many other organizations to do the work that they're doing through fiscal sponsorships, through organizational sponsorships. We have 2 partners here in the Zoom room today, but you will see AARP show up at conferences like Housing Iowa, conferences like the League of Cities, conferences like Iowa's Healthiest State. Today, we're helping host a dementia policy conference here in Des Moines to really start to focus on how we can increase the ability for us to think strategically about addressing dementia challenges in the future. So really that empowerment side is probably the biggest direct impact that AARP has across the state of Iowa.
And over here at the coalition, we focus a lot on education, advocacy, and partnership as our 3 pillars. As a members dues-based organization, we rely on membership and sponsorship to make our work actually go. And we rely heavily on our partners to do that on the ground work as well. But I like to always be kind of a gap filler too. And so we step up wherever it's needed. I'll just hit on a few things that we've been working on recently, especially as it pertains to the topic today, because we do housing across the aging spectrum. But one of the things that I'm very proud of is helping with Johnson County Residents United. So this is a resident-led organization of those residents in manufactured homes across Johnson County. And we partner with the Iowa Manufactured Home Residents Network, which is a network of other associations across the state in order to bring not only awareness, but active change to especially older adults or other vulnerable populations that reside in our manufactured home parks. As many people maybe are aware of, maybe if you've seen our news articles recently, or if you're not aware, there's a lot of out-of-state owned park owners that come in and diminish services while also increasing rents. We know that aging Iowans chose to move to manufactured home communities because lawn care was provided. Trash service was included. Most of them are on a single level after you first get into those front stairs. And so they were a really amazing opportunity that was affordable for our aging Iowan population. And now that we've seen these out-of-state actors come in and increase rents, not commensurate to, pensions or Social Security, we have a hard time of keeping older residents in their homes, and they're losing them due to non-payment and eviction. And then not only do they have to move, they lose that asset too. They often have to abandon it and it becomes the park's property. So there's a lot of issues that we have going on there. But personally, and with the coalition, we host JCRU meetings every other week in my office with residents, for residents, by residents, to be able to influence local policy, internal policies of those park owners, and then hopefully changing Iowa Code 562B to have stronger protections for those that live across all the parks in the state of Iowa. So I'm very proud of that work. And even the Gazette had been at our press conference earlier this week and highlighted that. So I would encourage you to check that out. Other things that we do here locally in Champion, we do a lot of policy work. That's whether it's pushing for local zoning changes. We were very successful in collaborating with city staff in Iowa City to allow smaller lot sizes a few years ago, to allow mid-block duplexes. It's very nuanced things, but it allows for a more diverse housing stock, which allows people throughout the age spectrum to choose where they wish to live. Another thing we worked with AARP Iowa on was accessory dwelling units. Us at the Housing Action Team of Johnson County Livable Communities was going one by one and changing zoning code within each municipality and trying to allow for these smaller accessory dwelling units, granny pods, grandma flats, attached or detached units that are a separate housing but on the same lot as a primary dwelling. We were doing it. We were going one by one, but AARP really championed a statewide bill in order to have bipartisan support and get that passed this last year. So thank you, Michael and Paige over there at AARP Iowa, because that is easier across the state instead of one by one. But we did have a lot of local support for that. Other things that we are looking at locally here is we are an early endorser and campaign champion of the local option sales tax initiative, trying to find flexible revenue sources and dedicated funding for local priorities. We are fortunate to be in Johnson County, where Iowa City, North Liberty, and Coralville all put affordable housing on the ballot language. So that could be for aging adults. It could be for home modifications. It could be for new development. It has a lot of flexibility that each of those city councils gets to designate. But I have a feeling, hearing especially about and seeing everybody here today, that it will be also used for the aging population as well. In general, we host a lot of community education as one of our pillars. We do a lot of public forums. I speak to people on these really fun webinars. And then we also host annual bus tours. A lot of people don't know about affordable housing opportunities, whether they're elected officials or heads of organizations or, just the average resident. And so we put people on a bus and we take them around and we show them what amazing opportunities that we do have here in Eastern Iowa. We only host one a year because those are extremely intensive for me. But we're doing a really great job with that. And I think our partners are very proud of that. I do lean very heavily on our partners as well to not only highlight those properties, but to do the good work. So a couple of these that I can highlight today, the Housing Fellowship, which is a nonprofit rental company that's in Iowa City, North Liberty, and Coralville, is going to be co-developing a new 55 plus building. I'm pretty excited that I was able to have them get together with this developer. It will be on the ACT campus, and it's called the Iris. Has a lot of layers of funding, including tax credits, and it's a little bit more complicated than I wish to even delve into. But making partnerships happen is kind of my jam, and I really love that that I have that opportunity here in Johnson County. Another example would be like how we talked about those home modifications. When you think of home modifications, you think, bathrooms or possibly ramps, or even just keeping a roof over somebody's head because it's leaking and would not be habitable if we didn't address that right away. So we partner a lot with the Iowa Valley Habitat for Humanity and their Helping Hands program. Aaron Kesey over there and Scott Hawes over there, they're amazing. They're amazing folks, and all of their volunteers as well. Keep people in their homes, especially older adults. I was just driving in Coralville the other day, and I saw this brand new ramp just to be able to keep an aging adult in place. And it is a beautiful sight to see that our residents get to choose to live in the place that they've been for quite some time. So again, I don't swing a lot of hammers, though I have. They ask me to, but other than that, I really rely on a lot of our key partners to be able to do so. So we do a lot of things over here, and I'm very excited about it, if you can't tell.
Yeah. That's amazing. So Jessica, I do just want to follow up with you really quickly. So I know affordable housing, I think that those two words can mean different things for different people. And I know that, the economy has been all over the place since COVID. So can you maybe just talk a little bit more about like what is affordable housing?
What is affordable housing? Yes. So by definition, affordable housing means that a household is not spending more than 30% of their gross income on housing related expenses. So typically we talk about rent or mortgage, but this can also go on to taxes. You can think about insurance, which has been skyrocketing, especially for rentals or homes, derechos, hailstorms and whatnot, climate change, love that. So it is spending no more than 30% of your household income on those related expenses. If you're spending more than 30% on your household expenses, you're considered cost burdened. In Johnson County, I just ran the numbers, and of course they're not going to be at the top of my head right now. I think it's 22% of homeowners are cost burdened, might be 17, but it's about half of renters are cost burdened. Then we also have a very large proportion of Johnson County residents that are severely cost burdened. They're spending more than half of their income that comes in each time from each month on their housing related expenses, over 50%. I believe it's 13.5% of renters are severely housing cost burdened. how that relates to older adults specifically too is when you don't have enough money to pay your rent, pay your mortgage, pay your taxes, keep the lights on, you forego other things. And especially when we're talking about older adults, it's often medical treatment and medication. These are things that people think they can go without or must go without because they just simply cannot keep a roof over their head. So I talk about this all the time, and I'm glad that you asked that clarifying question.
Mm-hmm. Absolutely. I think that's very important to note. And I do just want to follow up too. I know you've been talking a little bit about some of the legislation that you've been working on. Could we maybe just talk a little bit more? Is there anything that you're currently working on, something that you're hoping to work on in the future that can help address some of these challenges and issues? And this is open to Susan and Michael, but I know Jessica spent a lot of time on it. So
I'm going to pass it to Michael, though, to talk about the ADU bill first, if that's all right, because we were extremely successful in having this partnership come forth. So I'll give it to Michael because they were the champion of that bill.
Yeah.
Excellent. Yeah. So last legislative session feels like an eternity ago at the beginning of this year. The ADU, and really thinking not just about accessory dwelling units as an individual topic, but it's part of that missing middle topic that Jessica talked about of really creating a diverse and creative housing solution to the challenges that we're finding. AARP came at the ADU conversation specifically from the caregiving perspective. Across Iowa and really across the country, AARP is approached by a number of people that are talking about ways that they can continue to be caregiving or stepping into a caregiving model while keeping loved ones close and having a cost-effective perspective of that housing strategy. So, in addition to partners in the room today, but there were over 25 organizational partners, from realtors to contractors to other advocacy partners in the mental health, the social health spectrum that really looked at ADUs as one element to that. It did pass this year. It took effect on July 1, and AARP is partnering with APA Iowa, the League of Cities, and other development partners across the state to create additional guidance and support on how communities can implement ADUs locally, because like any legislation, it's wonderful to pass it. That's a huge hurdle. But the success of legislation is the successful implementation at the local level. So we want to make sure that AARP is empowering those other local partners, those other statewide and local partners to influence what the implementation could look like from city to city. And like Jessica said, it is a statewide law across all cities and counties in Iowa. Mm-hmm. Looking ahead towards our legislative priorities, it's something that we're still in the midst of developing as we start to look at next year. One of the things that you could see AARP showing up more in is local advocacy. And I love that Jessica had mentioned the LOST effort in Johnson County and how that connects to really the work that we're doing from an aging in place and age-friendly community. So if there is a local advocacy issue, maybe it's something large like a lost vote from a county perspective, or maybe it's something of just helping to advocate for a local curb cut in an important neighborhood, a crosswalk between a senior living facility and the park that's across the street. If there is something like that in any community across Iowa that you're thinking you could just use a little bit more support on, please don't hesitate to reach out to me at AARP Iowa, and we could look at how we can partner, whether that be through tools and resources, technical assistance, or lean in the support and credibility of AARP to a local issue.
I was going to add, at Trail, we haven't so far gotten involved in a lot of legislative issues, but I want to mention another organization, the Older Iowans Legislature. Not a lot of people know this exists. I can see Mike does. They meet, as I understand, once a year to talk about the issues most relevant to older Iowans that they would then present. They vote on them, and then they present them to the legislators to say, hey, this is where we would really like to see movement this year. And it's open to anyone. And so I would encourage you to, the audience members, to do a little research. Just Google Older Iowans Legislature and find out more about the organization and get involved in legislation that's going to affect all of us, either today or in the future.
That's a great plug. And the annual meeting was actually just this Monday, so
I
just a
thought
few
so.
days ago. So I could say very confidently that they are very much in a spongy, looking for ideas mode. So I second Susan's comment of Googling older Iowans legislature and looking at how to be a part of that if you are looking for an additional partner.
Great.
Absolutely. Good old oil. I love them.
That's the one.
Yes, absolutely. Well, I also sit on the board of directors for the statewide advocacy group called the Iowa Housing Partnership as well. And so we look at housing again across the age span. But we have a few priority levels. We're also going to have a meeting probably sometime in November to discuss those and rubber stamp them. So I don't want to say it's directly 100% there, but things that we're thinking about and championing over here. Removing, it sounds very technical, it's removing the cap on the allocation of real estate transfer tax revenue to the housing trust funds. It would mean just pulling the wording off of a bill that allows for any money that comes to and from the real estate transfer tax to actually flow to any of the 27 locally positioned housing trust funds. Throughout the state, the housing trust funds provide support, financial support for either new build or rehab or any other priority that community deems fit. So it's really passing money through to the people and knowing how it should be best allocated. So we have one here, Johnson County, that I sit on the board of directors for the Johnson County Housing Trust Fund, but look in your area too to see, do you have a housing trust fund? Is it your COG that maybe runs it? Polk County has a really robust one as well, and see how that funding is being used. And you'll probably be surprised how much is going to older adults. I mentioned earlier about protections and increased protections for residents under Iowa's Code 562B, which is Iowa Tenant Law for Manufactured Homes. We are attempting to, yet again, put forth a drafted bill that would provide stronger protections, right of first refusal for possible park ownership, justified fees. There has to be a reason for evictions, right? Just some things that, as an Iowan, we say, oh, that makes sense, but aren't codified into law and might have out-of-state entities come and be predatory towards those because it's not yet written in. So if you're interested in learning more about that, I would direct you to the Iowa Manufactured Home Residents Network page. It's within their Bill of Rights, and they can probably answer more questions about that than I can. The other two things locally that we're very interested in and with our partners across the state are increasing housing first initiatives and supportive services for reducing homelessness. Ourselves and our partners fought very hard this last legislative session against a bill that would criminalize homelessness. We see homelessness, again, across the age spectrum. It has typically been an older male adult issue. And as we're seeing affordable housing creep down and up the economic ladder, we're seeing families that are affected by homelessness. We're seeing DV victims affected by homelessness. We're seeing it across all spectrums. So we really want to put evidence-based practices into policy and make it codified within Iowa code to have housing first options and evidence-based support to ending homelessness throughout our state. So I'm going to, again, defer to my partners at Shelter House and at Homeward and across the state to draft that legislation. But it is extremely, extremely important that we do not criminalize homelessness, that we find evidence-based solutions for homelessness in our communities. Last one, I never thought I'd be a policy person, folks. I never thought it. Younger me is like dying on the inside. But it's eviction expungement. So oftentimes evictions are on people's records for life. And if you don't know, everybody has fingertip access to those iowacourts.gov. So it is a huge barrier for those seeking and keeping housing. Oftentimes over 50% of evictions in the state of Iowa are actually either wrongfully filed or overturned or no longer actually, affecting those that had it filed on them. And so we're advocating that those should be removed, sealed, expunged, whatever you want, just not at fingertip access for everybody to see. It is a huge, huge barrier for people across the age span to be able to access safe, decent, affordable housing. So again, that's one of our priorities.
Thank you for sharing all of that, Jessica. I do you've talked about some of the legislative challenges that you're seeing in the work that you're trying to do. Are there any other challenges, Susan, Michael, that you're seeing within your work that might be making it a little harder to implement some of these programs and resources?
We've talked about some of them. Costs, obviously. Michael mentioned the scams, which are everywhere. And I can't tell you how many, smart college educated people we know here who've been sucked in. These people are so smart and so evil. But I'm going to say something else that we talk about at Trail all the time. And I know Michael sees this. One of the issues that we face is denial about aging, right? We have these, we've talked already about all these wonderful services that are available in Johnson County and across the state, and how much people need them. But there's a little ageism, and none of us want to admit that we're getting older. But when we see situations where older adults desperately need help at home, help understanding what resources are available, and they're just saying, no, I'm fine. I don't need you. So somehow as a society, we need to do more to address something that Michael talked about earlier. What's good for an 8-year-old is good for an 80-year-old. Let's sort of just dispel this ageist thing and begin to understand that, seeking help is not a bad thing. It's part of ensuring your longevity and your happiness. So I think the denial of aging is something we need to talk about at some point.
Thank you for bringing that up, Susan.
Yeah, I think the other challenge that's always the elephant in the room these days is the ever-changing reality of policy from a national and sometimes state perspective.
Yeah.
And agree, disagree, wherever you stand, I think the challenge is the uncertainty. And as we start to think about playing the long game with age-friendly, with livable communities, with any program, it's very challenging to do that when things are changing day to day, hour to hour. AARP does, a big chunk of what we're doing right now is just trying to stay up to date and in front of as much as possible the issues that are changing on a day-to-day basis, but then looking towards how those federal decisions trickle down to state policy, to state budgets, and then eventually to local. Whether that be with Trail or with Johnson County, there are things that are already that are creating ripple impacts. Some of them may be positive, some of them may be negative, but understanding what those are and how to constantly adjust to them is a challenging barrier that a lot of us have to the work that we're doing. There's no easy, clear solution to that, like many things. But one of the things, two of the ways that we're really focusing on that is, one, whether it be within the 50 plus or our specific membership base, is really trying to empower people to be involved in that conversation, no matter where you sit on the spectrum. Communicating with state, local, and federal elected officials is more important now than it may have ever been, to make sure that stories that are on the ground and local and creating whether challenge or even bright spots of how we can make sure that those challenges and issues are being communicated to our elected official. The other side goes back to what I had mentioned earlier about our advocacy agenda and really looking at how local advocacy plays an important role into to game changing. The work that's happening in Johnson County is not necessarily driven by state decisions. It's driven by Johnson County or Lynn County or Cedar Rapids finding out what's best for them and working through that. And so AARP really wants to be to position ourselves to not only be a state and federal advocacy partner, but also a local partner, like I mentioned. And all of us have had the experience that if we are a stronger, tight-knit community, that creates a stronger, tight-knit social network. It creates a stronger sustainability for our community down the line. So in a world of uncertainty, and I get it all the time, of I don't know what to do. I'm confused about X, Y, or Z. It's how can you connect with your neighbors? How can you connect with your city council people, your mayors, to make sure that story is being told? But to me, those are kind of two challenges and opportunities that we have right now of really how do we create strong communities and just go back to basics, to the building blocks.
Mm-hmm.
And I'll just mainly say ditto to what Michael was saying at the federal level, specifically uncertainties. A lot of our partners work in a reimbursement model. So when they are, giving services, life-changing, life-saving services, and then, maybe the invoice out, you got to guarantee that money back, right? If it's policy now and it's great and they're following through, but in 6 months when they're sending that, invoice in and they're not getting reimbursed, that's money, that's time, that's people's salaries, that's services that can't be guaranteed. So we have a lot of direct service providers that are kind of in a wait and see moment, which isn't helping anyone, right? It's not helping at the federal level. It's not helping solve boots on the ground efforts here. And it's to no fault of our partners. And we're just living in a different world with federal uncertainty. And that could be the funding or the policy itself. So thank you, Michael, for definitely bringing that up. It is definitely felt here locally. And I've heard it from partners across the state as well, that it's difficult times.
I want to add to that, as federal support declines or is simply, unreliable for the moment, local nonprofits, not just Trail, but especially food banks, shelter house, you name it, we are all feeling much more pressure to step up our services. That's difficult in a lot of ways, but I think we're especially feeling it on finding enough volunteers to meet the demand. And as many of you know, a large percentage of volunteers these days are also older adults. So there's kind of pressure from all sides. And to underscore everything that's been said here today, only by working together in community are we going to be able to solve these things.
Right. That's a perfect segue just to put in a quick plug for the reality that we are coming into election season again, as we all know. But many communities have local elections coming up this November with city council, with mayors. And then as we go into next year, it will, as we all know, it'll be another midterm voting cycle. AARP is a national nonprofit, nonpartisan organization. We do not endorse candidates. We do not endorse parties. But what we do advocate for is voter engagement to make sure that your voice is being heard. It is a very confusing time for all of us out there, where we get our information, how we get our information, how we're cross-checking that information. So just an encouragement to find your trusted partner on where you can get the information, maybe find 2 or 3 to cross-check just because of lots of things flying around. But just a heads up, you will definitely see AARP out front and center as we come into 2026, advocating for voting, for all of us to be informed voters and to get out there and vote, because this is important to our communities, no matter where you stand on the spectrum, that your voice is being heard and that you have the opportunity to tell your story.
Absolutely.
Yes, that was a perfect plug, Michael. And I'm going to put in my own plug. I might be biased, but subscribe to the Gazette. We will be the ones giving you accurate election information. So yeah, there's my plug there too. But that was great. Thanks for bringing that up, Michael, because that's so important. And it looks like we're a little under 10 minutes, but I do want to reserve, the last 8 or so minutes to talk about what are some of the positive outcomes and stories that you've been hearing, whether it's through your outreach, research programs. What are some positive things that you've been hearing in the work that you're doing?
I guess we hear every day from our members, just basically, I don't know what I would do without Trail, especially those who depend on us for transportation, to medical appointments, to doing little things around the house. I mean, Jessica, you mentioned manufactured housing. I know we have a member in manufactured housing that she relies on a Trail volunteer to simply haul her garbage out to the curb every week and back. It's not something she can physically do. So it's the little things that make life more livable, right? And so we get a lot of gratitude around that. Also, I think, I mentioned before, some of the community services we provide. We published this year the 2nd edition of our Johnson County Senior Housing and Services Guide that lists all of the senior living communities, nursing homes, at-home service providers in Johnson County. That's free and available to the public. So we're trying to be here for everybody in Johnson County, not just our members. And again, we couldn't do it without our partners, AARP among them. And Jessica, I have a note to reach out to you to talk to you some more about how we can promote more affordable housing options for older adults. It's one of the things that we hear a lot from our members. I love what you people do, but I can't afford to live here anymore. So thanks for all you do.
Awesome. Yeah, I'm happy to collaborate with anybody with anything. I truly love Johnson County, and our board of directors is here for the long haul too. So Susan, yes, we will definitely be in touch. I think that the best thing, kind of alluding to what Susan was saying, is those small little stories are just the moments with the direct people that we serve. So speaking about, resident empowerment, hearing from folks that are in a very, very precarious state in manufactured homes, right? There's not a lot of power there, but we're bringing people together to have a collective voice and seeing, I won't use names, seeing one of my residents who was scared beyond her wits to be able to talk in front of, people, is now coming up and grabbing the microphone and talking about her experience and saying, this is not okay. We deserve livable communities. We deserve fair treatment. We deserve clean drinking water. We deserve maintained parks. I mean, just those moments are amazing. And anybody that wants to come and sit with me in these meetings and cherish those moments is more than welcome to do so. They're not mine to hold. They're to share with our community, right? And so I'm just so fortunate to be in Johnson County with the residents that we have, but also on all of our campaigns, the relationships that we are building with local elected officials. Mm-hmm. You'd be surprised. They're people too, in case you didn't know. They're people too, and they will come and have a coffee with you. They will come and talk. They are more than open to be engaging with you, not just at the public policy forums or these simple, events. They want to know you as people. So I just really appreciate and cherish knowing that the people that we're electing to serve in our community and across our state can be engaged with effectively, open and listen and hear from both sides, right? There's going to be conflict, there's going to be issues, but if we can have active dialogue between everybody in our community, again, 8 to 80, I love that, Michael. I'm going to keep using that, 8 to 80. Mm-hmm. I think it's just going to make us even stronger as a community.
And Michael, I don't want to cut you off, but I will say I did have an audience question come in.
Yeah.
So if you just want to, we do want to hear some of the positive things that you're hearing.
I'll do 15 seconds. I appreciate that heads up too. The three the bright spots that I would focus on is we are across the board seeing higher engagement with events and activities, which tells me that people are, whether it be post-pandemic or whether it be just the time we're in, people are really looking for in-person connections. We are seeing a lot of local organizations like Trail that are really picking up a mantle of a gap in services as we age. I'll put a plug in for Fairfield Cares is another organization similar to Trail. They have their annual symposium this Friday or Saturday, tomorrow, that I'll be talking about different partnerships related to caregiving. And then the last bright spot that I see over and over again is, and we're seeing it more, I think now, is diverse partners that didn't used to sit around the table are now sitting around the table. And I don't know that there's much fruition that's come to a lot of those tables yet, but it's the fact that it's happening that is creating it's positioning for us for success long term.
Mm-hmm. That's great. And so one of the questions that I have, we only have time for one, but an audience member is asking, what sort of advice do you all have for people in their 40s who want to prepare to age in their homes and their communities? I think that's a great question.
Be aware of the resources that are available. Talk to people who are older, right? I think those of us who have gotten into our 60s and 70s wake up every day surprised by what's happened to us. And, they didn't prepare us for aging when we were in high school. So talk to older adults, ask them what their challenges are. It can be the physical things like make sure your house is accessible and, has the grab bars or whatever, but also get involved with organizations that are serving older adults. Volunteer for an organization like Trail. take our people around to their medical appointments, get acquainted with what it means to age, and take care of yourself. To me, that's number one. If you're going to age successfully, you got to be able to do it physically and mentally. That's what I would say.
I love that. I would ditto everything Susan just said. And the only thing I would add is to get to know your neighbors. I think one of the things we talk about is there's family caregivers, there's caregiving networks. But I know that I could speak from my neighborhood perspective is there's a couple older residents that live in our neighborhood that are fighting tooth and nail to stay in their home. And I know that they feel comfortable giving me a call. Having my teenage kids mow the lawn or pull the trash cans out or figure out the new TV remote, all of those things make a big difference. But knowing your neighbors and feeling comfortable to call them when you're in need creates that stronger community that we could all age.
I think even just you asking that question now shows that you're prepared more than most Iowans, right? So you're already on the right track, whoever asked that question. But make a housing plan, right? It's so much easier to plan forward when you have that time and opportunity, and make a realistic plan, right? Make a realistic plan. If it's grab bars, it's never going to be cheaper than doing it now, because in 5 years, it's going to be more expensive. But being realistic with that plan instead of being in crisis mode when you all of a sudden wake up and you are 70 and you're in a oh no moment, where can I find a 2-bedroom home? Start looking now. Do it on a flexible time. Take a nice drive around your neighborhood, maybe with your neighbors, and see, well, that would be nice, and just come up with this theoretical what if. If you don't even ask those what ifs, you're going to always be stuck in what is. And so that's my only advice, but that's a great question. Thank you for asking it.
Yeah.
Good response.
Absolutely. Well, we are at time. I feel like we could have just kept talking the rest of the afternoon. This has been a really great discussion. I do just want to thank our audience for joining us today. You can also join us for another discussion in community and economic development, which is about community impact and growth, and that's at 11:50. Thank you again so much for attending Iowa Ideas, and thank you to our presenting sponsor, ITC. And thank you so much, Michael, Jessica, and Susan. It's been absolutely wonderful having you, and it's been a great discussion. So thank you all so much for being here.
Thanks, everybody.
Thank you, Emily.
Have a great weekend,
Thanks, everyone.
everyone.